I don't want us to think that laboratory assessment, including culture and sensitivity, are always needed, and the data certainly supports that statement, which is obviously why I included it here. You know, if you look at many of the studies, for example, using Bactrim to treat ANCA vasculitis, using cephalexin to treat atopic dermatitis, those studies are based on the research showing the association, in this case with both of those diseases, with Staphylococcus aureus. And the research studies that are published may or may not have included culture of those individual patients prior to treatment. However, in clinical practice, whether the original studies used culture or not, we don't have to use culture because, first of all, a lot of the studies didn't use culture. They just treated the patients empirically based on previously published research, and they still had safe and effective results. But again, we can look at the patterns that are published in the research, and we can look at patterns with which our patients present and make decisions based on those patterns, again, without always having to rely on individualized microbial assessment. Now, as we kind of ramp up, let's say, or ante up the therapeutic intensity of our programs, then I think that that does require a higher level of skill, a higher level of communication. Again, not necessarily laboratory analysis every time, but certainly that may have a role. For example, what I'm talking about, or at least what I'm thinking about, and we'll now talk about, is when we transition, let's say we start out with an antimicrobial agent such as berberine. It's very effective. It's not always effective, just like nothing's always effective. But we can use berberine empirically without laboratory assessment and see if we get the result that we want. If we don't get the result we want, we may go to another antimicrobial agent, let's say augmentin, for example. So with berberine, the risk of using berberine is almost zero. I don't think I've ever seen a patient, and I've never seen any reports of adverse effects to berberine